Hi everyone, I am Dr. Professor Shivani Majumdar, the work in different medical colleges. I am actually asked by my senior student that they says that please do the video of the eyeball. So today I will discuss about the human eye. Now human eye, you see, it is located within a cavity. You will see here the cavity that is within, this is known as the orbital cavity. And you will feel the eye, you will see it is soft. This eyeball is located in the anterior 1/3 of this. This is the eyeball. This is actually occupy the anterior 1/3 position of the whole of the orbit. Rest of the orbit, you will see the rest of the orbit is occupied by the muscles, blood vessels and the nerves. Next, you will see what is the boundary of the orbit, you should know. Now this orbit, you will see the floor of the orbit is bounded. This is the orbital surface of this bone which is known as the maxilla, and roof is formed by the orbital plate of the frontal bone. You will see here in the that is the base of the skull. This is the orbital plate of the frontal bone which forms the roof of the orbit, this portion, the roof. And here lies the portion of the brain which is known as the frontal lobe of the brain. This is the frontal lobe of the brain where our intelligence lies. Next, the lateral wall is formed by, this is known as the zygomatic bone. It has got many processes. You see this bone which forms the malar prominence, this is known as the zygomatic bone. And this zygomatic bone has got a orbital plate that forms the lateral wall as well as the part of the roof. And next lateral wall is formed by a bone which is known as the sphenoid. So I will tell you that lateral wall, it is formed by the zygomatic bone, the orbital part of the zygomatic bone and the greater wing of sphenoid. You see this is the sphenoid bone. It looks like a bird with wings stretched. So this is the orbital part of the greater wing of the sphenoid. This is the greater wing and this is the lesser wing. So the lateral wall is formed by this bone. Next, the medial wall. You will see the medial wall is it is the thinnest wall, very thin. It is the thinnest wall. From before backward, you will see the bone that forms the medial wall. You see that this is the lacrimal bone where lies our lacrimal sac, which is the storehouse of the tear, and you will when you will cry, then the tear goes down into your nose as well as it comes out from the face. Next, you will see here you will get the labyrinth of the id point. So that is contains, this labyrinth contains anterior, middle and the posterior group of ear sinus. So medial wall is very thin. So you will get the boundary of the orbit. Now boundary of the orbit is important because there is the periorbital trauma. Somebody has actually make a fist and you will fist on you and there will be the injury in the eye. And you will see, now I come to the proper discussion of the eyeball by showing you a model. I show this is the size of our eyeball, you see, and the human eyeball is that of the same of the like that of the pig's eyeball. You see, the optic nerve comes out from the nasal side of this eyeball. Now this eyeball is separated from the cavity and also the other structure by means of a capsule which is known as the Tennant's capsule. So I will show you that the photograph of an real human eye. You see, this is the real human eye, and here you will see the person the doctor holds on the optic nerve, and this is the portion of the iris, and this is the portion of the sclera. So this small eyeball the human being possesses, and this eyeball has got the function that is of the camera. The beautiful camera is actually given or gifted by the our higher power so that we can visualize the color object. Now I will show you the model of the eyeball, which is much bigger than this small eyeball, and you will see the outer blue color here represents a tough fibrous coat that is known as the sclera. In our body, the sclera, you will see in your mirror, you will see the white color. That coat is known as the sclera. Now this is the outer tunic. Now when you remove this outer tunic, then you will see there are another layer is there. You will see, and this is known as the choroid. And inner to the choroid you will see another layer that is known as the retina, where there is formation of the image, and that image is transmitted through the nerve via optic nerve. It goes into the occipital cortex of the brain. This is the occipital cortex of the brain. Here all processing of the images takes place. That means how you will memorize this and how you can, the artist, you will see they have got tremendous power of memorization and visualization of this area, and this area is very much increased in case of artist. Now the sclera, you see this sclera, this is actually the thickness of the sclera varies in the different region, where the muscles, the extraocular muscle which moves our eye is inserted, that part of the sclera is thin. The sclera is more thin where the optic nerve comes out. It is more or less perforated, and this part is known as the area fibrosa sclerae. So this is the sclera. It gives shape of the eye and also protection of the eye. Next come to the region that anterior portion of the sclera, that means 1/6 part of the sclera become transparent, and it is lined by stratified squamous epithelium, and the epithelium has the power that it becomes the transparent. It is 6 layer of epithelium, but it is transparent, and this cornea is avascular, as well as that is there is no blood vessels, blood artery, vein, and the no lymphatic. That's why when there is the blind, that is due to corneal opacity, you will see one can, if one can donate after the death the cornea, then 2 of the people is lucky enough to visualize again. So the donation of the eye is very important, and the eye should be taken within 6 hours after the death. And you will see in the hospital, the most of the eye bank fellows, they actually they take the eye from the hospital just after the death, and by the taking the permission from the patient party. So this is the cornea and the sclera. Next you will see that the choroid, and you will see the choroid is the highly vascular organ. It is not visualized here because it is a model. So the choroid consists that this uveal tract, better you should say, consists of a posterior part which is known as the choroid, and the anterior part which is known as the iris. You see, this portion is the iris, which is the color varies from different people. The Indian people, their color is actually brown to black. But in the western country like the England, there the royal blood, there actually you will see the pigmentation is deep blue. So their eyes are blue. Then nowadays the person can change their eye by putting the lens of different color, and they can actually elevate their look. So this is the iris, is the muscular diaphragm. In between the choroid and the iris there lies another thing of the uveal tract that is very important, that is known as the ciliary body. Now this ciliary body actually suspend another thing which is known as the crystalline lens. This is the cornea, then you will see the crystalline lens. So this crystalline lens is suspended by the ciliary processes. There are very thin ciliary processes, and these processes is actually circular, and it actually holds the lens. Now the shape of the lens changes because this lens it is the jelly-like substance, and this lens is covered by capsule. When during the removal of the cataract, the capsule is cut, the lens is coming out, and within it there is implantation of the artificial lens, but one can see easily. So this is the lens, and this is the, you see, the ciliary processes. Now the ciliary body, it secretes and material, that is the aqueous material, which is known as the which is known as the aqueous humor. Now this aqueous humor actually it comes in front of the cornea, actually between the cornea and the lens, and this portion is known as the anterior chamber. So this is the anterior chamber. The depth of the anterior chamber varies from person to person, and behind the lens there is another chamber, that is the small posterior chamber. You will see here in this region there is these two chambers communicate with each other, and at the margin of the cornea there is a canal, and that canal is known as the canal of Schelm. And this canal of Schelm actually absorbs the production of the aqueous humor, so that there will be no rise of the intraocular pressure. Next is that, so these are the three parts of the choroid. Next you will see the another layer, you see, that is the retina. So this retina, you will see it has got two layers. Now what are the two layers you will see? You will see in this retina it has got a pigmented layer. This pigmented layer you will see is known, and there is a nervous layer. These two layers develop from different sources, and these two different sources, there is a gap between the two layers. There is a potential gap, and when in case of high pressure or in case of any rise in the intraocular pressure, which is known as the glaucoma, this there is separation of these two layers, and this is known as the retinal detachment. And depending upon the detachment, the vision is diminished. Sometimes there may be the total blindness. Now it is cured by the ophthalmologist. So this is the retina. Now this retina ends in front by means of a rough corrugated margin, and this margin is known as the ora serrata. You can see this one, this rough margin. This is visualized or not? So this is known as the ora serrata, and these are the ciliary body. So you can see the different coats of the retina, their functions, and their actually how they are located. Now this eyeball, if you cut a section of the eyeball, which is seen in the actually in your book, that is the section of the eyeball. So in the section of the eyeball, there is a picture in your book where you will get that in the section from anterior posteriorly what are the structure lies in the eyeball. That means the light rays which comes from outside, it penetrates this region, comes to the hole which is known as the pupil, and then from the pupil the light goes to the anterior chamber, posterior chamber, and next to a transparent portion which is known as the vitreous body. And in the vitreous bodies there is a depression, you will see, and in the vitreous body you will see there is putting of the lens, like you see the patella lies in the patellar fossa. Similarly the lens lies in this vitreous body. So this vitreous body is also transparent. There is no blood vessels, but during the development there is the blood vessel. So you will see, so these are the refractive media of the eye. From before backwards there is the transparent cornea, then there is transparent fluid, that is the aqueous humor, then you will in the posterior chamber there is also aqueous humor, then the lens, and the rays of light is regulated by these pupil. You see there is the diaphragm. When you will go to the cinema hall, you will see your pupil is dilated like this. When you come outside, the pupil is very much small. You can see this in the cat which we see in the roadside. You will see in the cat, in the daytime you will see there is a just vertical slit, the pupil, and when it is at the night it is a big one. Similar mechanism occurs in the human body. It will regulate the light like that of the camera. Next you will see that, so all of these are the refractive media of the eye. What are the muscles that controls the eyeball movement? You will see the muscles of the eyeball I have shown to you. You will see these are the arrangement of the muscles of the eyeball. There are 4 recti muscle arises from a hollow. So there are four recti muscle. Rectus means straight muscle. So that stress muscle I will show you here. It moves our eyeball, and also two oblique muscle. One oblique muscle which is known as the inferior oblique. It is attached at the floor of the eyeball. Another is attached at the roof of the eyeball. And what are the movements of the eyeball? I will show you. You can you will see I open this eye in such a manner, otherwise you cannot visualize. So this is the moving upwards of the, I make the eye retracted, the the palpebra eyelids are retracted upwards. You will see the eyeball properly, and you will see there is movement of the eyeball upwards by superior rectus, downwards by inferior rectus, medially by the medial rectus, and laterally when you look it outside, that is the lateral rectus. And the oblique muscle, this actually twists the eyeball. Those who can rotate the eye, those who produces the villain character, they can rotate the eye, they practice it. So you can see this is the movement of the extraocular muscle, and all extraocular muscles are supplied by the third cranial nerve or the oculomotor nerve, except LR6-SO4. That means LR6 means lateral rectus by the sixth or abducent nerve, and the SO4 means superior oblique by the, that is known as SO4 trochlear nerve, the fourth cranial nerve. So this is the nerve supply of the muscles. Now this muscle is very important because somebody from the birth has got some defective muscle power, and there is the difference in the movement of the eyeball, and this is known as the squint, and this squint may be corrected by the operation. You will see the here in the book, in the undergraduate book, it is written that all muscles, they are inserted actually 6 millimeter away from the sclerocorneal junction. But who does the surgery of the squint, they know what are the difference between the insertions. Some are 5 millimeter away, some are 7 millimeter away. So they will know this. Next thing, I have discussed about the clinical anatomy now of the eye. I have discussed all the features. Now what is the clinical anatomy? Now I have told you during the discussion that we have got the eyelids. Now in the lid there are different types of clinical correlation you will see in case of eye, though it is a small organ. In the lid there are some glands, they are known as the sebaceous gland or the sweat gland. So accumulation of sweat or sebum in this region, they will produces elevation in the eyelid, which is known as calazion and hordeolum. So one can operate that calazion or hordeolum. Now you will see the eyelashes also. There may be some problem in the eyelashes when in the aged group, because you will see in the aged group the muscle around the eye, which is known as the orbicularis oculi. You will see how can you feel the orbicularis oculi. If you close your eyes so tightly that you cannot put any medicine here.
Bas.
This orbicularis or oculi arises from a thin slits along the margin of the orbit. You will see. So this thin muscle you can feel in your own eye, 1 to 2 millimeter of thickness. They have got such a strong power of closing the eyes. So in this eyelid you will get this type of difficulty. And within the orbit there is also a gland which is known as the lacrimal gland, and this lacrimal gland actually they produces a secretion which is known as the tear. So you will see lacrimal gland is situated in this region, and this lacrimal gland has got two parts. One is orbital part, another part comes to the palpebra. So this is known as the palpebral part. You will see this one is the palpebral part and that one is the orbital part. So lacrimal gland, it secretes the tears which moisturizes our eyes. Always we blink in every time, and this blinking takes this water from lateral to medial side, and in the medial side the sac is present. In this region there is the lacrimal sac. You will visualize this. This is the lacrimal sac, location of the lacrimal sac, and from the lacrimal sac there is the nasolacrimal duct is come out from the inferior meatus of the nose. So from this lacrimal sac there may be the affection of the lacrimal apparatus, and there may be infection and produces dacryocystitis. In Bengali it is known as the netronali in this region. And next feature, so we complete the lid portion. Now from the lid, so if there is dryness of the eye, then what will happen? There is the loss of the vision due to the corneal ulcer. The lens, you will see, it may be affected by, in the old age, by the cataract. That means there is opacity of the lens. There may be the congenital cataract also. So I have discussed more of the things during the time of discussion. Only thing remain in the case of the common thing, that is the specs we used. The most of we use the pegs. So what are the different refraction deformity you will see? You will see the portion, somebody cannot see the object in the near object. They suffers from myopia. That means the vision is actually formed in front of the retina. They are corrected by the biconcave lens. And somebody suffers from hypermetropia. That means the eyeball is small and that is vision is located behind. So they are given plus power. And myopic, they are giving minus power. And we, those who crosses actually the 40 years of age, we suffer from a thing that is known as the presbyopia. That means there is the relaxation of the lens, the ciliary body does not contract much, so there is the difficulty in focusing the object, near object, and this is corrected by the plus power. And astigmatism, that is actually the curvature of the cornea is varies. That's why there is the difference in the power. So I think all of you can appreciate this. Thank you everyone.